the microscopic analysis. If we continue with the microscopic analysis, there is a variety of normal and abnormal cellular elements may be seen in the urine sediment, such as all these stuff. Examples of abnormal finding: pair high power field HPF 400x magnification, more than 3 erythrocytes, more than 5 leukocytes, more than 2 renal tubular cells, more than 10 bacteria. Per lower, this is the normal, this is the abnormal values. Per low per field 200x, 3 hyaline cast or 1 granular cast, 10 squamous cells indicative of contaminated specimen, any other casts like RBCs, white blood cells. Presence of fungal hyphae or yeast, parasite, viral inclusions, pathological crystals like cysteine, leucine, and tyrosine, large number of uric acid or calcium oxalate crystals. Let's talk in details of the types of the product of the microscopic analysis. You can see cells, either erythrocytes. The normal value is the normal value of erythrocytes is less than 10 per HPF. The leukocytes, you can see either neutrophils or eosinophils. You can detect with Hansel test. It's a kind of special stains. If you can see epithelial cells, it's either squamous cells, indicative of a contamination, renal tubular epithelial cells, few or normal, transitional epithelial cells, few or normal, oval fat bodies abnormal, indicate nephrosis. The bacterionuria, more than 10 per HPF. The yeast candidiasis, the more common, may be a contaminant, should correlate with clinical picture. You can see viruses, you can check for viruses as well, like the CMF. Well, this is a probable viral cystitis. Casts. Erythrocyte cast due to glomerular disease, leukocyte cast due to biochemistry, the presence of pus in the urine, typically from bacterial infection or glomerular disease. Degenerative casts, either granule cast, non-specific, like TAM horse foal protein, hyaline cast, non-specific as well, waxy cast, non-specific, fatty cast, nephrotic syndrome, oval fat body cast. Crystal, there is a lot of number of crystal. You will deal with these types of crystal in details. Continuing the cell, we can see hematuria. What is hematuria? As you know from before, it is abnormal presence of presence of abnormal numbers of red cells in urine due to any of these possible causes. White blood cells, you can see from the figure, first figure, how the RBCs look like under the microscope, while in the other figure you can see the arrows, how the white blood cells look like under the microscope. The white blood cells in high number indicate inflammation or infection somewhere along the genital tract or the urinary tract. You can see here the most type of casts are from the figure as well, are the hyaline cast, red blood cells cast, and white blood cells cast. The hyaline casts are solidified THP secreted from the tubular epithelial cells and seen in fever, exercise, damage to glomerular capillary, while the RB casts are indicative of glomerulonephritis, which lead to the leakage of RBCs from the glomerular or severe tubular damage. The white blood cells casts are most typical for acute inflammation in the kidney due to bacterial infection. Crystals. Urine contains a large number of different crystals under different chemicals. Under some circumstances, these chemicals may solidify to form salt clusters. These called crystalluria. Crystals can be found in the urine of healthy individuals. So you can see from the figure types of normal crystals and types of abnormal crystals. They may be caused by minor issues like a slight excess of protein or vitamin C, changes in urine pH and temperature after collection. Many types of urine crystals are relatively harmless. In some cases, urine crystal can be indicator of more serious condition. Diagnostically significant crystals may indicate presence of metabolic disorder, renal canaliculi formation, or provide information that can be used to regulate medications. Here you can see the names again, which is important between the normal crystals and abnormal crystals. The types of urine crystal. First one, as you can see, different forms of the figure. Types uric acid crystals. Different types such as barrel, plate, like rosette or diamond. Typically orange, brown, or yellow in color, found in normal acidic urine when caused by protein-rich diet. They can also be caused by kidney stone, gout, or chemotherapy. Symptoms of kidney stone include severe abnormal flank or groin pain, nausea, difficulty passing urine, and blood in the urine. Symptoms of gout can include burning pain, stiffness, and swelling in a joint. The treatment depends on the underlying condition but the important thing is to stay hydrated. This is one of the best ways to treat the crystals themselves for the uric acid. Calcium oxalate, you can see different figures for the calcium oxalate crystals, are shaped like dumbbell-shaped or envelopes, colorless and can found in healthy urine, acidic or neutral, heavily associated with kidney stone, too much oxalate found in spinach. These crystals can be caused by the ingestion of ethylene glycol, which is toxic and is an essential ingredient in antifreeze formulation. These crystals to detect for these crystals you need a freshly voided urine, and this might be indicative of a condition called lithiasis due to hypercalciuria. Lithiasis is the formation of a stony concretions, caliculi in the body, most often in the gallbladder or urinary system. زي حصوات في الجول بلادر المرارة. Hematuria crystals. Hematuria crystal, as you can see from the figure, are very rare. They may be either yellow, brown, or clear. They often resemble needle-like prism or plates and often found in clusters. Can also occur in healthy or acidic urine. Amorphous urate, it's a brown or colorless granules indicative of sodium or potassium in the urine. Amorphous phosphate, it's a brown or colorless as well, indicative of calcium or magnesium. Calcium phosphate crystals, as you can see from the figure, colorless and appear star-like, needle-like or plates, single in clusters, appear in normal or alkaline urine. In rare cases, this crystal could be caused by hypoparathyroidism. Symptoms of this include tingling in the hand and muscle cramping. Treatment may include drinking more water, getting more calcium, and taking vitamin D supplements. Calcium carbonate crystals, large round disc, dumbbell-shaped, rhombohedral forms and smooth surface, appear in alkaline urine. These crystals, crystals of calcium carbonate, which is a supplement you can take to get more calcium, are also frequently associated with kidney stones. Bilirubin, you can see bilirubin in the urine as a very small needle-like yellowish-brown granular appearance, appear in acidic urine. The high level of this bilirubin or bilirubin crystals in your urine could indicate liver disease or poor liver function. Magnesium ammonium phosphate or sturvite, they call it sturvite, as you can see from the figure. They call it as well triple phosphate, aka triple phosphate. They often colorless, rectangular prism, coffin-lid shape found in basic or neutral urine. This coincides with UTI. If a UTI causing these crystals, antibiotics are prescribed to clear up the infection. Ammonium biurate crystal, as you can see from the figure, these crystals are brown sphere with spiky horns. They resemble small bugs, appear in normal or alkaline urine. Sometimes these crystals appear because urine sample is old and not freshly prepared and has been poorly preserved. Because of this, recollecting the urine sample may be advised to do another test. Cholesterol, you can see cholesterol crystals in the urine. They are clear and shaped like a long rectangle with a notched corner. They are most likely to appear after the urine sample have been refrigerated, found as well in both neutral and acidic urine, and this caused by renal tubular disease or other condition where there is a deposition of lipid in kidney. Cystine, as you can see from the figure, it's a color hexagon in acidic urine. It is a rare condition and often genetic. Symptoms may include blood in the urine, nausea, vomiting, and pain in the groin or back. Leucine, yellow-brown disc with concentric rings, not found in healthy urine, found in acidic urine. They are typically a symptom of severe liver disease. Tyrosine, of course, these three types of crystals are based on the amino acids. Tyrosine crystals are colorless, needle-like, found in acidic urine, caused by a metabolic disorder like liver disease or tyrosinemia. Symptoms include difficulty gaining weight, fever, diarrhea, blood stools, and vomiting. Indinavir is a medication is used to treat HIV. It can cause a formation of crystals in the urine, like the figure. These crystals may resemble starburst, rectangle plates, or fans. Oval fat bodies, its large brown spots associated with high proteinuria content and nephrotic syndrome. The link between these oval fat bodies considered as a link between the nephrotic syndrome and lipiduria. The link is not known. Lipiduria seems to be related to the proteinuria and not to the plasmatic lipid level. Sulfadiazine and sulfonamide crystals, flat needles, chivels of small needles as spheroids, often brown in color. These indicate the administration of the drug. That's mean the patient is using this drug, the sulfonamide. However, their presence also associated with kidney stone formation. Aclovir crystals, rarely seen. This based on the drug, it's an antiviral drug for treatment of herpes simplex infection, found in alkaline urine, and they are fine needles and colorless. Hemosiderin crystals, you can see that they appear in the urine 2-3 days following a severe hemolytic episode. Coarse yellow-brown granules, found free floating or within cells, stained with a type of dye called Persian blue. Radiographic dye crystals, similar to cholesterol in appearance, and they associated always with markedly elevated Hg. Ampicillin crystals, rarely seen, found after a massive dose of ampicillin. Slender needles in clusters and colorless. Form chivos forming refrigeration. There are other urinary sediment artifacts like fecal contamination with plant and meat fibers, like fibers, you can see the fibers from plant, like hair and fibers, like pollen grains. These are different artifacts in the urine. Other artifacts like glass fragments in the urine. Strange, but it can happen. Starch granules, and you can see oil droplets or air bubbles in the urine. These all are artifacts, not crystals. This is a very good slides. You can see the difference between the names of all the slides we have taken and the shapes, and this is a very important slide. As well, this is another slide. You can see the difference and the names between the different slides. And this as well, you can differentiate between cells, cast, crystals, and others, and with the name of each crystal. These kind of collective slides or summary slides are very important. So actually, this is the same slide. You can train, and after memorizing the last slide, you can train on this slide to put the names of the different shapes of the crystals. Again, this is a collection for the types of crystal and their names. So crystals generally can be classified into normal acid crystals, normal alkaline crystals, abnormal crystals of metabolic origin, and abnormal crystal of heterogenic origin. That means came from drug. Actually, this is all the name we just described. This table for knowledge to see how the presence of these crystals relate with the pH, the color of the urine, its shape, the heat, the alkali, the acidic acid reaction. As well, this table is for knowledge for the rest of the crystal. This table as well for knowledge to see the same and the tests needed for each type of crystal. It's only for knowledge. Same here, continuing of the crystals. Thank you.